This is HIM2214 Health Statistics. This presentation is coming from the textbook Basic Allied Health Statistics and Analysis, 3rd edition, Gerda Coach. More specifically, Chapter 4 from this textbook on census. So our learning objectives for this presentation is to distinguish between census, inpatient census, and daily inpatient census. Distinguish between inter-hospital transfer versus inter-hospital transfer. Distinguish between adults and children, A and C, versus newborns, N, B. Distinguish between patients included in a bed count versus bassinet count. Define inpatient service day, IPSD. Define admitted and discharged, A and D. Define period as used with regard to statistical computation. Describe when a census is to be taken. Identify deaths that are excluded from inpatient statistics, and be able to compute daily census, period census, average census. When we use the term census, the first thing will probably come to our mind is the U.S. Census that's done every 10 years through the U.S. Census Bureau, where they pull or gather information about the population in the United States. And this is very relevant, the principle of that is similar to what we're going to talk about here in terms of the census. When we define the census, it is the number, in terms of hospital statistics, it's the number of inpatients present at any one time. According to the glossary of healthcare terms, in general, in regards to the definition of census, the American Heritage Dictionary defines census as an official, usually periodic enumeration of the population. All right, but in terms of our course, we are looking at the number of inpatients present at any one time. In general, a census is a count of people. All right, so the first term we're going to talk about for our statistics class would be the inpatient census. And with your inpatient census, that's when we are looking at how many inpatients are in that hospital at some particular or some specific period of time. And furthermore, we're talking about inpatient census. When there's an inpatient, we mean that person, we discussed the definition of inpatient. That person has a bed in that hospital. They're staying more than 24 hours. Patients at a hospital, they could be inpatient or outpatient, and we should be very familiar with those definitions. So we talked about the inpatient staying at least overnight. They have been formally admitted to that hospital. They have a hospital bed in which they are occupying. Versus the outpatient, we know what outpatient is. They do not stay overnight. Their services are for whatever that particular time period is during that day, and then they go on home. Your hospital statistics are the majority of them are not going to be inclusive of your outpatient. There may be something here or there in which outpatients are included, but for the most part, they are excluded from our hospital statistics. We have had the opportunity to talk about departments in the hospital, units and services. These are important. We know that the departments are gathered around particular types of functions, as well as the units and services. and certain statistics are being calculated in these different departments and within these different units and services, and it has a bearing on the way that information flows for statistical computation. All right, so let's talk a little bit more about the hospital census. Again, this is in reference to inpatients. Our hospital census is counting inpatients. When they do the census, it has to be at a specific time. It doesn't matter what time it is, but it has to be consistently done at that period of time, whatever time is chosen. Usually that time is going to be midnight for most hospitals that you come across. So we're counting patients that are admitted to the hospital, and we're going to take that census, or we're going to count those inpatients at a consistent time every day, which is usually midnight. Now, this counting of the inpatients, or this census taking time, which you will see abbreviated as CTT, it can be manual or automated. This depends on the facility. If the facility is indeed computerized, then that information that they're entering on the patients and the treatment and the interactions during that period of time is going to be used to calculate the census. And so no one has to do it personally or manually. However, if this is not an automated process, then there's usually going to be an individual who's going to be responsible for doing those counts on the patients that are present in the hospital during that CTT or that census taking time. All right. So what they're going to be looking at when they do that, what's going to be of importance is how many were present at the last census taking time. So if that time is midnight, then how many patients were present this past midnight. Then we're going to consider how many patients since that time have been admitted, how many have been discharged, how many have been transferred in or out. All of these things are going to have an impact on what the count is going to be for the next census taking time, or CTT. What you also will notice is that each department, all of the departments will do their own departmental census or on those different units, but there is usually a central area that's going to take all that data and do a computation to do totals, right? So they're going to take all that information, collect all that information in a central area, and that area which is designated to do that will do the total daily totals and monthly totals, and all the totals that are needed for what we just discussed. Okay? Now, I talked about the transfer in and the transfer out that will have an impact on your CTT. And we talked about transfers before. We talked about intra-hospital transfers and inter-hospital transfers. With the intra-hospital transfers, if you recall, that's when a patient is transferred into a particular unit or they are transferred out of that particular unit. These will have an impact on the CTT, and they will be counted as transfers. However, your discharge transfer is going to be counted as a discharge and not really a transfer when we're looking at our actual statistics reports. All right? So your intra-hospital transfers are considered to be transfers, and your discharge transfers are considered to be discharges. Now, your book brings out a very good point that should be noted is that your total intra-hospital transfer in should always equal your intra-hospital transfer out. Talking about totals at the very end, once you get them all calculated and pulled together. So that's a good key point to pay attention to when you do your statistical computations. The other thing your book talks about in terms of transfers is that a transfer is counted as a census patient only on the unit on which that patient is present at census taking time. So when we talk about transfer in, transfer out, that means they are moving from unit to unit. So we're only going to count that patient one time. And the unit that's going to count that patient is going to be the unit in which that patient is present when we begin to do CTT. So if that time is midnight, wherever that patient is located at midnight, whichever department that is who is going to count that patient. Right? So they're only going to be counted once. That could be confusing if all departments are counting them, then they're being counted multiple times, and this is not an accurate CTT at that point. All right, A&D stands for admitted and discharged on the same day. This is not an outpatient because an outpatient is a patient or an individual who comes in, receives their services, and they leave on the same day. Now that may seem similar to the A&D because they leave in one day as well, but the difference being that an admitted and discharged on the same day patient is one that has been formally admitted to the hospital, was occupying a hospital bed. However, they were discharged that same day. So they were actually an inpatient. They just were admitted and discharged on the same day. Now that is usually a very small number in the scheme of our hospital statistics, and this could occur for several different reasons. Your book brings out that patient may have been admitted and they die during that same day. So that would mean, and we talked about death being considered discharge, so then they would be admitted and discharged on the same day. Maybe they had a discharge transfer, so we admitted them into the hospital, but then they were transferred out to another facility that same day. That is considered a discharge, as I was just mentioning, and therefore that would be A&D. AMA could be another reason, which means against medical advice. Maybe they were admitted and then they wanted to leave on their own personal for their own personal reasons, and so we get them to fill out that AMA, and again, you have an A&D, admitted and discharged. So the difference between an A&D and an outpatient is that an A&D has actually been formally admitted and had a hospital bed, versus an outpatient was never admitted to a hospital as an inpatient, and they did not occupy a bed. So there's your difference. All right, so this is A&D are admitted and discharged on the same day patients. Okay, so we were using the term hospital census, we were using the term census. You may hear the term inpatient census, or hear the term inpatient present at CTT. This is all the same thing. So census, hospital census, inpatient present at CTT. We're talking about the census where they count the inpatients present at that hospital at that specific time, whatever that consistent specific time is. All right? So that's how we calculate the hospital census, or the inpatient census, or the inpatient present at CTT census, or just the census. Okay? Now, another term you need to become familiar with is what we call the daily inpatient census, DIPC. The daily inpatient census is going to differ just a little bit from our hospital census. Because when we calculate our daily inpatient census, we are going to count the inpatients present at CTT plus our A&Ds after CTT the previous day. All right, so let me explain. When we count inpatients or our regular hospital census, we do not include an A&D. Think about it. If I take, say today is, whatever today is, let's say it's March 1st. Okay, and so midnight, March 1st, I take census. I have someone who's admitted on March 1st, but they are discharged before midnight of March 2nd. When I get ready to do my count on March 2nd, that A&D patient is not there or not present, so they will not be in my census count. Now, when we look at daily inpatient census, it's going to count inpatients present at CTT plus those A&Ds that came in after CTT the previous day. So back to my example, on March 1st, I did my CTT. I had an A&D come in on March 1st, discharged before my CTT on March 2nd, but I would count that A&D in my March 2nd daily inpatient census, DIPC. All right? So that's the difference between your regular census and your daily inpatient census. Your daily inpatient census is going to include the A&Ds. Your hospital census is not. Okay? Now, another one is your average inpatient census. All right? So average inpatient census is going to, or your average daily inpatient census, I think I got that wrong there, but your average daily inpatient census is what I'm trying to put there. Now we're going to look at the average of them. So we're going to take the average number of inpatients present each day for a given period. So maybe at that one particular time, that daily inpatient census, we're looking at one particular point or time. With your average inpatient census, we're going to look at a bunch of these census over a period of time. The formula for that is the total inpatient service days for a period over the total number of days in the period. We're going to talk about inpatient service days in just a minute. But the formula for that is the total inpatient service days for a period divided by the total number of days in the period. So when we start talking about averages of something where we were just talking about one date singularly, average brings in several dates or a whole period of time. Okay? So in the numerator for that average inpatient census, it said the total inpatient service days. So let's talk a little bit about service days. Now your inpatient service days are services received by one inpatient during one 24-hour period. You may hear this called patient day, inpatient day, census day, or bed occupancy day. This all refers to inpatient service day, but we're going to use IPSD or inpatient service day. So it's one services received by one inpatient during one 24-hour period. So any patient who receives services during that 24-hour period, it will count as one inpatient service day. Now, if you think about that just a little bit, this calculation pretty much is going to come out to be the same total as your daily inpatient census that we talked about, because your daily inpatient census counted each inpatient plus your A&D, because A&Ds are going to receive services, right? They may not stay but during one day, but during that one day, they did receive services, so you're going to count them. So that means your daily inpatient census and your inpatient service day is going to be the same total. Now, if you're looking for the total inpatient service days, this is going to be the sum of all inpatient service days for each of the days in the period. All right? That's how you're going to get it. The sum of all your inpatient service days for each of the days in the period. So if I'm looking at the month of February or the month of January, each day I'm going to get those inpatient service days and I'm going to add them all up. That's going to be my total inpatient service days for January. Okay? Now, I've kind of sort of mentioned deaths already in the discussion. the thing I said about deaths are that deaths are considered to be discharges, or you see say D/C for discharge. Deaths are discharge. They are included as discharges. So if we are trying to get the total discharges, deaths will be included unless there's something unless it's saying it wants live discharge. If it's asking for live discharges, then deaths are not included. But if you want total discharges, deaths would be included. Deaths and live discharges, as a matter of fact, would be included in total discharges. Now, what we want to pay attention to is that fetal deaths are not going to be included in this. When we're doing hospital statistics, fetal deaths are not included. Basically, when that child was born, they were already dead. So they're not included in that statistics or in those formulas unless we are calculating statistics on fetal deaths. Then we are counting fetal deaths. But if it's just your basic hospital statistics, they are not included. The other type would be your dead on arrival. They are not going to be included in this because they were dead once they arrived to this hospital, unless we are calculating something specific to DOAs. Okay? Outpatient deaths are not included in our hospital statistics. Outpatient information is maintained separately. All right? It will be in the outpatient. If we're doing some type of outpatient statistics, they are outpatient death statistics, then they will be included in that. All right? So now the next, last couple of slides that I have is going to be related to some tips in terms of calculating everything that we just talked about. All right, the first thing we want to talk about is the different units of measures and totals and periods that it's asking for. When it's looking for a unit, we are looking for that the smallest amount or measure for that particular thing we're looking at. So in terms, if we're doing inpatient service days, that day is the unit, right? An inpatient service day, a singular term, day. Now, if they're asking for the totals, then we're looking at combined amounts, days. Like we did total inpatient service days. So now we're looking at a period of time that had several days that we are considering. Even when we were doing the average daily inpatient census, it was a period of time, and we're combining those unit measures together to come up with our totals. In those where we're asking for totals, you're going to see them say periods a lot of times in your formula. So like in the denominator for that period of time. When we talk about period, that's more than one day. Comprised of period. It could be week, it could be month, it could be a year, it could be 5 years, whatever that period is that is indicated, that's what we're going to consider in our formula. All right? That's what a period is. Now, what you also are going to notice when we're looking at a lot of our statistical reports and stuff, when they're computing statistics, you're going to see them use that daily inpatient census and that inpatient service day totals versus just your CTP total, because they're a little more accurate and reflect a little better what's actually being done at the hospital. So that's what you're going to most often see. Your CTPs are really only counts. They just count them, but your daily inpatient census and inpatient service days totals are a little more reflective of what's going on. If you recall, they are including those A and Bs. All right? Now, the other thing that was very good that your text brought out, when you get ready to calculate these daily inpatient census and your A and Ds and all these things, you might want to utilize plus signs and minus signs and cross out different things that don't apply to your formulas, because sometimes you're going to get more information than what you need. So, for example, if I'm trying to calculate my daily inpatient census or whatever type, what you need to understand is you're going to take your census from you're going to take your last census count, and then you're going to start adding and subtracting based on what we're considering. So I would take my last census count, or my last CTP, and if I have some admissions during that day, then they're going to be added to my last census count. If I have some discharges, they're going to be subtract, so I'll put minus plus. So maybe I got them all listed. I might put plus by my admits. I'll put minus by my discharges. I'll put plus by my transfer in. I'll put minuses by my transfer out. If I'm just doing a regular census, then I will cross out my A and D's because I'm not counting those. But if I'm doing my daily inpatient census, then I'll put a plus sign by A and D. So then when I get ready to go back and actually do my calculation, I'll take my last census and just add wherever I got plus signs, subtract whatever I got minus signs by. And that will give me my total. So that will be very helpful to you so that you will have accurate totals when you're doing your calculations. Some other things we need to look at that in terms of designation for statistical purposes. You have beds and bassinets, adults and children, newborns. A lot of times these are going to be separated. You're going to have bed counts and you're going to have bassinet counts. You're going to have A and C counts and you're going to have NB counts. You most often are going to see these separated unless something says so otherwise. They usually keep these calculations separate. The other thing you need to note here is you're going to more often see them using calculations for averages because, again, like I was talking about your BIPCs and your IPSBs, these are more representative and they are more easy to use when we're trying to do comparative analysis. Okay? Other thing that's important that they're talking about, you need to know the number of days in a month when you calculate, because sometimes in your problem it may be given to you, sometimes it's not. So if it's telling you how many in the month of April, you need to know how many days in that month. Your book gave you a couple of different ways to keep up with that, because sometimes that you can forget that, even though it's simple information. They have like the jingle and your knuckle. For the jingle, it says 30 days, half September, April, June, and November. All the rest have 31, say February, which has 28 in line, and leap year makes it 29. As you remember, February could be a leap year. So that's one way to try to remember what months have 30 days and what months have 31. Your book also talks about using your knuckles. You may have learned this in elementary school, grade school. It says make a fist with both hands, keeping the thumbs hidden. Start at the little finger side at either hand and begin with January. Point to the top of the knuckle. Then name the month by pointing first to the knuckle and then to the depression between the knuckles. If the month lands on a knuckle, the month has 31 days. If it falls in a depression, it has either 28 or 30 days. Any month except February will have 30 days. So you can also do that. I remember learning that in school. So you can try either one of those. That's on page 75 for your review if you need help with that. And it kept mentioning about the leap year. So you have to be careful to what year they're looking at to determine whether February, how many days February has for that year. And they told you in order to determine whether it's a leap year, you divide the year by 4, and if the quotient is a whole number without a remainder, this is a leap year. So I gave an example of 1988. For the year 1988, divided by 4 results in 497, and there's no remainder, which means 1988 is a leap year. Okay? So you divide whatever the year is by 4 to determine if we are in a leap year, because sometimes you're doing a period of a year, and you need to know how many days are in that year, and so it's going to rest on how many days February had to know specifically. All right, so that's something else you got to look at. Last couple of things it talks about is rounding, and we covered rounding in our mathematical review. And so you may have to round different figures depending on what you're calculating. So you need to follow the rules of rounding, and you should know how to do that. Also, just basically looking at your answers to see if it's logical. If you're looking at something in particular, and maybe your number is way out there, like 1,000,000 or 5,000, and you know you doing how many A and D's, and we already talked about being a small number depending on what that is. If you know that doesn't sound reasonable, you need to go back and check it out. So you get the general recommendation here. Look at your answer and determine whether that's logical based on the context of your problem. And sometimes you can catch a red flag, like I might need to go back. I don't think this is correct. Okay, so you need to keep that in mind. This is going to conclude my presentation on Chapter 4, Census.